Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Introduce my name is POPY, majoring in nutrition, undergraduate program of applied nutrition and dietetic, regular B. In this video, I will explain material about low energy and protein or malnutrition. Let's check it this video. Next, definition. Malnutrition is a condition of lack of consumption of nutrients caused by low intake of energy and protein in daily food. Next, cause of malnutrition. 1. Lack of nutrition intake from food as a result of the occurrence of a disease that causes infection. Other factor, availability of nutrition and affordable food, behavior and culture in food processing and shelter rearing, poor management and inadequate health care. Next, let's see in this video.
Malnutrition is a major health problem among elderly people who are considered a high-risk group. It affects 2 million people in France. It is responsible for 40% of hospitalizations of elderly people and affects up to 70% of hospitalized elderly people. Malnutrition is an energy imbalance and can be endogenous, where energy needs exceed intake, and/or exogenous, where energy intake is insufficient for energy needs. These two origins have a reciprocal effect. Elderly people are most frequently deficient in proteins, energy, vitamins, and minerals. Malnutrition among elderly people is a slippery slope leading to a vicious circle of events where the patient's nutritional status is constantly subject to change. It results in weight loss and fragility, which can in turn lead to longer and more frequent bouts of illness, which can have a significant impact on the elderly person's morbidity and mortality.
Next. Malnutrition is divided into 3 types. 1. Marasmus, 2. Kwashiorkor, and 3. Marasmus kwashiorkor. Marasmus clinical symptom. 1. The child looks thin. 2. Face like an old man. 3. Crepey fuzzy. 4. Sunken belly. Wrinkled skin, little to septic fatty tissue, often accompanied by chronic diarrhea or constipation and chronic disease. Blood pressure that tend to be low or hypotension. This picture physical description is muscle atrophy and fat is very thin or detected. Next, other clinical symptoms. Impaired physical growth and development or body weight. Other 60% dull hair, sometimes blonde, dry or usual blocker, hypotropic and hypotonic muscle tissue, abdomen bulging or concave, with a clear picture of the intent, the type of a hand and feel felt, cold and appear get noted. This picture physical description is hair is still black and clip-on rib and very skin. Next, let's see this video.
Malnutrition is a serious issue that is common in the world, especially in developing countries. Let's find out what is malnutrition. Malnutrition can be caused by eating too little or too much, or an unbalanced diet that does not contain all nutrients necessary for good nutritional status. Types of malnutrition. Number 1 is overnutrition. There is an excess intake of one or more nutrients. People with overnutrition have a greater risk of chronic diseases like diabetes or cardiovascular disease. Number 2 is undernutrition. This occurs due to an inadequate intake of one or more nutrients. Following are the conditions that can occur due to undernutrition: PEM, protein energy malnutrition, anemia, goiter and rickets, etc. Now let's find out what are the causes of malnutrition. Inadequate dietary intake and infections are immediate causes of malnutrition. Dysphagia, in which you can't swallow food easily. Malnutrition can occur. In cancer, disease chemotherapy makes eating difficult due to nausea. Vulnerable groups for undernutrition. Preschool children. Teenage boys and girls. Pregnant and lactating women. In PEM, the person's body doesn't have enough nutrients to perform routine functions. So the body starts to get energy from muscles, skin, and fats. In this way, the children become prone to infections. They begin to feel weak and lazy and cannot perform routine work. Now we will talk about the two types of protein energy malnutrition, but before that, EDM is calling out selected dietitians with unique stories and special offerings to get featured in our magazine. We will give you desired exposure on all social media platforms. So what are you waiting for? So back to the topic. There are two types, kwashiorkor and marasmus. Kwashiorkor is caused by a deficient intake of protein. Mild symptoms include the child's moon face, a child becomes irritable, anorexia, fatty liver, enlarged liver, and swelling, edema. Marasmus. In marasmus, children will have low weight for height. Its causes are severe deficiency of all nutrients, especially proteins, carbohydrates, and lipids. The child appears like skin and bones. They have sunken cheeks and wide eyes, and hair becomes sparse and easily pluckable. We should work together to eradicate malnutrition from this world. This video is for general information only and does not constitute provide.
Okay, next. This next material is stunting. Stunting is a condition of rare to thrive in children under 5 due to chronic malnutrition, so that children are too short for their age. Malnutrition occurs when the baby is in the womb and in the early day after the baby is born. Stunting is only seen after the baby is 2 years old. Stunting categories that score under mean 2 and 2-3 SD. Okay, next. Different between short phase stunting. Short, gene of hereditary factor, normal cognitive or intellectual function. Short structure children are usually short parent. Stunting is the result of chronic malnutrition since in the womb 2 years old, aggravated if attached to chronic or recurrent infection, low cognitive function or intellect or impaired brain development, low IQ, BBL under 2,500 gram, and PG under 48 gm. Until the age of 2 years, the growth of TB does not match. Okay, next. The long-term impact of stunting. Stunting also increases the risk of obesity and non-communicable disease or PTI, such as hypertension, heart disease, diabetes, cancer, and other diseases. Reproductive health can also be affected and will decline. Next, therapy. 1. Treat prevent hypoglycemia. Give a solution of 50 ml of 10% glucose or 1 teaspoon of sugar in 5 tablespoons of water via mouth or sonde. Give every 30 minutes for 2 hours. Each time, give quarter part of the ration for 2 hours. As soon as possible, feed every 2 hours, day and night. Next, 2. Treat or prevent hypothermia. Warm it with a blanket or place in the near a lamp. The temperature is checked until it reaches 36.5. 3. Overcome or preventive dehydration. Oral rehydration by giving 5 ml or kilogram every 30 minutes. If you can drink, give it a necessary lactate glucose 5% Ranger solution and 0.9% in ACL. Okay, next for correction of electrolyte disorder. In severe cream, electrolyte balance disturbance occur including excess body and eye, even with plasma and eye level are low. Electrolyte imbalance therapy, K2 and milligram magnesium 5 overcome or prevent infection. Cotrimoxazole 5 ml, ampicillin 50 mg kilogram body weight, amoxicillin, chloramphenicol 25 mg. Give vaccination if egg 6 months and have never been vaccinated. Correction of micronutrient deficiency. Folic acid 1 mg per day, 5 mg the first day, zinc 2 mg if you start to gain weight, Fe 3 mg, sulfate 10 mg. Oral vitamin I is used for age 0 until 5 months, 1 year, and 6 until 12 months. Okay, now starting feeding. Stabilization phase day 2 until 7, administration of F75. Transition phase week 2, administration of F100, F100, rehabilitation phase week 3 until 7, administration of 100 to 25. Okay, next. Facilitate get of growth, MT, provide sensory stimulation and emotional or mental support, affection, careful environment, play therapy for 15 until 30 minutes a day, physical activity immediately after recovery, mother involvement, feeding, bathing, playing. And the last, prepare follow up the recovery. Parents are check regularly, re-immunization or booster, give vitamin I every 6 months. Vitamin A deficiency, dermatosis, disease caused by parasites or worms, diarrhea continuous, tuberculosis treat according to tuberculosis guidelines. And then last, thank you for attention. See you, goodbye. Wassalamualaikum warahmatullahi wabarakatuh.